Assalamu alaikum viewers. I'm Dr. Asif Mahmoud Rafi, and today we will discuss a topic which is important in both nephrology and rheumatology. So it is vasculitis. We need to learn about vasculitis to answer various cases in nephrology and rheumatology. So let's start our discussion. So at first we need to discuss about the pathophysiology of the vasculitis. So what is it? The inflammation of the vessels is named vasculitis. So mostly this vasculitis is an autoimmune disease, and sometimes we may find some association with hepatitis B or hepatitis C. And sometimes some organ involvement may be found due to the immune complex deposition. So in the autoimmune diseases, there are formation of the antibodies, and this cross-react with the antigens, the self-antigens, and this immune complex may traverse the whole body, and that can cause this immune complex deposition and immune complex mediated inflammation. So this is the basic pathophysiology of vasculitis, and as we can see the picture, the normal blood flow is like the first picture, as we can see in the lower picture. We can see that there is reduced blood flow, and this is because of the inflamed and thickened arterial wall that is caused due to the vasculitis. So the vasculitis is causing the inflammation of the arterial wall, and this is causing the thickening of the arterial wall, and this narrows the blood vessel, and there is reduced blood flow. So this produces all the symptoms. So it is very important to understand that this is the reason why the symptoms develop. So now we just classify the vasculitis. So what is the classification? I think it is important that to memorize the classification, I always learn the classification from the large vessel vasculitis towards the small vessel vasculitis. So the large vessel vasculitis, these are the giant cell arteritis and the Takayasu arteritis. So as a mnemonic, more or less so, I remember the giant cell arteritis, there is a giant word. So giant is large. So the large vessel vasculitis, it is a large vessel vasculitis. In Takayasu arteritis, Taka, this is in Bengali, the Taka means money. So it is, money is a big thing. So Takayasu arteritis is a large vessel vasculitis. So by this I memorize the large vessel vasculitis. Two are there, giant cell vasculitis and Takayasu arteritis. And now the medium sized vessel vasculitis, I remember by a Japanese pen. So Japanese pen, the Japanese word, the Kawasaki Disease, and pen is polyarteritis nodosa. So the medium sized vessel vasculitis is Japanese pen, Kawasaki Disease, and polyarteritis nodosa. So I just memorized these four names in large vessel and medium vessel vasculitis, and all the other vasculitis, those are small vessel vasculitis. So what are the others? The microscopic polyangiitis, Wegener's granulomatosis, Sharp-Strauss syndrome, Boettcher syndrome, Henoch-Schönlein purpura, cryoglobulinemia, all these are the small vessel vasculitis. So other than this, we need to know one other differential that is very important. With vasculitis, it often comes in the questions and also the clinical practice. There is vasculitis-like feature. So it is Goodpasture syndrome. So what happens in the Goodpasture syndrome? There is no inflammation of the vessels. What happens there? It is an autoimmune disease, and there is antibodies against the basement membrane. So type 4 collagen of the basement membrane. So it causes the basement membrane problem. So why are the basement membranes? In the kidneys and in the lungs. So it produces renal failure and pulmonary failure. So it is Goodpasture syndrome. So it is an important differential of the vasculitis. So we need to remember what is Goodpasture syndrome and what are the other vasculitis. So now we come towards the general symptoms. In generally all the inflammatory diseases, they produce this fever, fatigue, weight loss, anorexia. So this is the general symptoms. So in all the vasculitis, we will find these general symptoms. So what are the other specific symptoms? So we need to learn about the specific symptoms I have put together all the symptoms that the vasculitis can produce in this part of the discussion. I think it is important to memorize all these symptoms and just pick the symptoms for every disease. That would be a very easy way to approach or to diagnose a patient or to answer a question in all the postgraduate exams. So the specific symptoms, the first thing is a vasculitis rash. Vasculitis rash, what is this? There is small vessel vasculitis may produce these symptoms because there is in the skin, this is supplied by the small vessels. So if there is small vessels inflammation and ischemia, so that will cause the rashes. So this is the vasculitis rash. Now we come towards the eyes. So eye is generally a medium vessel because the orbital artery, the eye, blood supply of the eye, if it is hampered, it causes the blindness. So in giant cell arteritis, sometimes this happens. So this eyes symptoms like blindness is a feature of vasculitis, mainly in the giant cell arteritis. And in the nose, the nasal mucosa, if there is crusting inside the nasal mucosa, this happens in granulomatosis with polyangiitis or the Wegener's granulomatosis. So the nose, we need to know the nose, it is involved in GPA. And the fingers and toes, if there is ischemia and inflammation in the small vessels in the hands, so there will be the vasculitic experience, and this symptom is called the Raynaud's phenomenon. And there is pain and tingling in the fingers and toes, which we know as a Raynaud's phenomenon. And in the nerves, blood supply, if the blood supply of the nerves are hampered, there will be damage of the nerves. So there will be peripheral neuropathy. So the small vessel vasculitis, which causes this nerve damage, is mostly EGPA, eosinophilic granulomatosis with polyangiitis, or the Boettcher Syndrome. This causes this nerve damage and this produces this peripheral neuropathy. And now we come towards the joint pain. Sometimes the joints are involved, mostly in the Henoch-Schönlein purpura or IgA vasculitis. In IgA vasculitis, it is named IgA vasculitis because there is deposition of IgA all over the body. There will be IgA deposition in the skin, in the kidney, even in the joints. So sometimes muscles are also involved. And when the lungs are involved, mostly in EGPA, there will be shortness of breath. So it is a common differential of unresolved asthma. So the asthma is not resolving with the common asthma treatments. Then the differential of EGPA or eosinophilic granulomatosis with polyangiitis or the Boettcher syndrome comes into our mind. There is inflammation of the lungs and there is coughing and shortness of breath in EGPA. In brain, if we see that there is vessels involved in the brain, it is called cerebral vasculitis. Many of the diseases produce this cerebral vasculitis. So the brains are also important. So kidneys are generally involved as it is the most vascular part of our body. So whether there is immune complex formation, the immune complexes will go towards the kidney and get deposited in the glomerulus. So it will cause symptoms like glomerulonephritis. So the most common disease we need to know is microscopic polyangiitis, where the kidney involvement is the most important thing. So these are the symptoms, general symptoms. Generally, we have discussed the vasculitis and the symptoms. So we need to know and remember all the symptoms. I know that it is a very difficult task to get it done all together, but I think if you learn in this way, it will be easy to memorize. So now we come towards the specific vasculitis from giant to small. So in the giant cell arteritis, the Takayasu arteritis is the first one. So Takayasu arteritis, there will be involvement of the aorta and its branches. So if there is involvement of the large vessels, there will be less blood flow and the pulse will be lessened. So as the pulse goes lower and lower, it becomes a pulseless disease. So it is very important to understand that what is a pulseless disease is the Takayasu arteritis. We have to picture a young female, a 25 to 30-year-old female with lack of pulse, so there will be no pulse, there will be claudication pain in the hands or legs. So we need to keep it in our mind that it may be Takayasu arteritis, though it is a rare disease, but in MRCP or in the postgraduate exams in medicine, it is very important to understand the rare diseases also. So in investigations, the most important thing, we need to see those arteries, those giant arteries that may be by aortogram. So we need to visualize the arteries and it will show that there is narrowing. So the diagnosis of Takayasu arteritis will be made and the treatment is steroid. So in all the vasculitis, the most important treatment is steroid. So we don't need to learn the doses as much as we do, but sometimes the doses are important, but in general the steroids are the treatment. So now we come towards the second disease of the large vessel vasculitis, which is a giant cell arteritis. And we need to know that polymyalgia rheumatica, it is a separate disease, but it comes together with the giant cell arteritis. In postgraduate exams in medicine, some of the diseases may come together. We need to understand that those diseases, those come together. So it is one, the giant cell arteritis and polymyalgia rheumatica, PMR and GCA. So the giant cell arteritis mostly involve the upper part of the body. The upper part, medium and large vessels are involved. So there are some vessels, like in the eye, sometimes it can present with visual disturbance. The eye vessel is involved, and sometimes there is headache, and the temporal arteries are involved. So there is temporal arteritis. So it is also named as temporal arteritis. So the giant cell arteritis, the key features will be there can be headache, there can be visual disturbances, as I red marked these points, and the investigation is the temporal, the common investigations like CBC, ESR, CRP, and the temporal artery biopsy. So this is the investigation, and the treatment is also corticosteroids. So what is PMR? The polymyalgia rheumatica. This is as the name shows, there will be stiffness and painful restrictions of the shoulder movements, and there will be weight loss, fatigue and night sweats. These are the common symptoms. So it is the PMR, polymyalgia rheumatica. So in GCA, giant cell arteritis, the steroid dose is higher, and in PMR the steroid dose is lower. So that's just we need to know. Now we come towards the medium vessel vasculitis, which is the Japanese PEN, is polyarteritis nodosa, and Japanese the Kawasaki disease. So the polyarteritis nodosa, the PEN, generally we need to know some important things regarding this. The PEN is always or mostly associated with the hepatitis B infection. So hepatitis B is very important. Polyarteritis nodosa and hepatitis B, these are very important terms. So there is palpable purpura, ulceration and livido reticularis. These are the common symptoms, and there may be also renal involvement. So the treatment is high dose steroids. So this key things we need to know about the polyarteritis nodosa. Then we come towards the Kawasaki disease. The Kawasaki disease is basically a pediatric disease. So it is not that important. So just need to know that children less than 5 years, Kawasaki disease can occur and mainly involve the coronary vessels. Sometimes angiogram or the echo shows the abnormalities, some of the abnormalities, and the treatment is aspirin and IVIG. So that's all we need to know about the Kawasaki disease. Now come towards some of the small vessel vasculitis. I will discuss it here and some in the other video where I will discuss the ANCA associated vasculitis. So these small vessel vasculitis I will discuss now are non-ANCA associated. So there will be no positive ANCA. So what are those? The Henoch-Schönlein purpura or HSP or IgA vasculitis. So the name suggests that there is IgA deposition all over the body. And I remember this Henoch-Schönlein purpura by P disease, because there is purpura, there is P, there is palpable prurite purpuric rash, there is pain, abdominal pain, there is polyarthritis, then there is pathy, nephropathy, IgA nephropathy. So these are the P's we need to remember for Henoch-Schönlein purpura. So that's it. The treatment is symptomatic, and the important thing is the prognosis is usually good. In children, it usually gets self-limited. So this is all about HSP. And the most important thing about cryoglobulinic vasculitis, I need to tell you that the cryoglobulinemia, cryo means cold, so, and globulinemia means globulins in the blood. So some of the globulins that are normally in the blood at a normal body temperature, it gets precipitated in cryo, like in the cold weather or cold temperature, it gets precipitated. So precipitated where? Precipitated in the blood vessels or in the kidneys, anywhere. So this is called cryoglobulinemic vasculitis. So just remember some of the points. I know that this is a difficult chart to remember. So just remember some specific points. There are 3 types: type 1, type 2, and type 3. In type 1, I always say that type 1 is IgM related, type 2 and 3 is IgM and IgG, maybe. So just remember type 1 is IgM and type 2 and 3 is others. So IgM, whether there is IgM, so just the M letter, you just need to reverse it, it becomes W. So W is Waldenstrom macroglobulinemia. So the Waldenstrom macroglobulinemia is spatially associated with this type 1 cryoglobulinemic vasculitis. And what is the feature of Waldenstrom macroglobulinemia? There is features of hyperviscosity. So type 1 Waldenstrom, type 1 IgM, reverse it, Waldenstrom macroglobulinemia, features of hyperviscosity. The Raynaud's phenomenon, acrocyanosis, venous occlusion, these are the common symptoms. Now the type 2 and type 3, these are mostly same and mostly associated with hepatitis B and hepatitis C, sometimes associated with lymphoproliferative diseases. So the features are, there will be rash, arthralgia, there is ulceration, erosion. These are the common features of type 2 and type 3. So these things should be remembered for cryoglobulinemic vasculitis. I want to repeat it. Type 1, IgM, Waldenstrom macroglobulinemia, hyperviscosity symptoms. Type 2 and 3, IgG, IgM, hepatitis B and C, lymphoproliferative disease, purpuric rash, arthralgia, ulceration, that's all. So this is all about cryoglobulinemic vasculitis. So just now we want to go to Boettcher syndrome and be specific about it, whether in the question, wherever you find there is ulceration of the mouth and in the genitalia, you should keep it in mind that Boettcher syndrome should come to the differential diagnosis. So the important thing is there is oral ulceration, genital ulceration. These two are very important, and the patient may be from the Mediterranean zone. Mediterranean zone has the most cases of Boettcher syndrome. There is an HLA association of B51, and there are some other symptoms, like there may be redness of the eye and some skin lesions. So these are the key points of Boettcher syndrome we need to remember. So that is all about the common vasculitis, the large vessel vasculitis, medium vessel vasculitis, and the small vessel vasculitis. We will discuss the other small vessel vasculitis, which are the ANCA positive vasculitis, in our next video. So hope you liked the video. If you liked it, just subscribe to our channel. Thank you very much.